This time, Dr. Tom Fletcher battles a mysterious body invasion.
It felt like something was moving in the sole of my foot.
He's walked around barefoot, you know, in the mud, whether he's picked up something there.
Dr. Tim O'Dempsey tackles a mass onslaught.
We're not quite at the zoo stage, but we're getting there.
I was actually wanted them to cut it open there and then.
And lab boss Wendy Bailey comes face to face with the enemy.
It isn't dead. That's it was his death throes.
This crack team wages war on deadly bites and alien body invasions, battling lethal infections from around the globe. Only they stand between you and bugs, bites, and parasites. The Royal and the Liverpool School of Tropical Medicine are at the forefront of the global fight against parasitic invaders and infectious killer bugs.
Do you know much about black widow spider bites?
Dr. Tom Fletcher is on placement with the Tropical and Infectious Disease Unit at the Royal Liverpool as part of his specialist army medical training. Having served in Iraq and Afghanistan, he's well equipped to battle exotic bugs, whose identity can be a mystery.
What sort of really appeals to me about sort of tropical medicine and infectious disease is that absolute challenge of diagnosis. So when someone presents, and for example, they've just got a fever, and they've got no other clues as to which system might be affected, it's a real challenge to try and work out what's causing that fever.
Fever is one of the most common symptoms in the unit, but the causes can be anything from malaria to myiasis, dengue fever to deadly snakebite. It's the late shift at the Royal, and Tom Fletcher is tackling an urgent admission.
Hello there. Mr.
Hello,
Lewis,
sir, you all right?
Nice to meet you. How are you doing?
And
My
you,
name's
sir?
Dr. Fletcher. I'm one of the infectious disease registrars.
OK, mate.
How are you doing?
Not so bad.
Okay, so obviously I spoke to the nurse in the walking centre before.
Yeah.
But what I want to do is essentially start from scratch, really. Ask you all the same questions again, really. Then I'll examine you top to bottom, then we'll come up with a plan, OK?
Yeah.
3 weeks ago, carpenter Barry Lewis returned from honeymooning in Cameroon with his new wife and her family. But his holiday of a lifetime has put the 43-year-old in hospital with a severe stomach disorder and high temperature.
Cameroon is a beautiful place. It was hot. The people were lovely. It was just a beautiful place, especially in the jungle as well. It was nice.
This was Barry's first trip to Africa, and he took risks a more experienced traveller might have avoided.
Apparently, you can catch things in the streams. And the tap water, I was brushing my teeth with the tap water. I'm rinsing my mouth out, which I shouldn't have done, really. And then I was eating food. People cook it in the street, and you go past, and I was eating it from there. So I shouldn't have done that in hindsight.
Barry was fine when he first returned home to Liverpool, but since then, he's developed an unwanted honeymoon souvenir.
I come back and I felt okay, but then I just started feeling unwell in my stomach.
OK. What was that with? Did you have diarrhea at that time or not? Or have you had diarrhea since then in the last 2 weeks?
Last week was absolutely atrocious, man. I'll be plain about it. The diarrhea, when I first got it, it was horrendous. It was like water. And my stomach, every time I went to bed, my stomach went into a fight. And I was up and down all night, which is not nice.
Barry has another, even more alarming symptom.
When did this come up on your foot?
Miraculously, overnight.
So literally overnight from
I went to bed with 2 little marks here, and it was infuriating me.
Okay.
I was scratching it right through the night, half asleep, and I woke up, and it's become like that.
OK, so literally...
It was literally an
2
overnight
little
thing.
marks.
Yeah. I thought it was odd. Like these 2 little lumps, and I thought, where did they come from? It felt like something was moving in the sole of my foot. So I was pretty fearful of that, actually.
It could be a parasitic infection in his foot, an unusual bacteria that he's picked up from that environment. You know, even if you've got a penetrative larvae from, he's walked around barefoot, in the mud, whether he's picked up something there or he's picked up something from fresh water. It's a long way since to get that sudden onset of that lesion there.
To establish what he's dealing with, Tom Fletcher orders tests.
Okay.
Thank you so much.
All righty, so you'll be in for a bit of time for us to do all these tests and various...
What do you say,
Well,
time?
I mean, obviously this is quite nasty. We need to do a few urgent blood tests anyway, okay? Plus we need to exclude malaria, which will be at least 3 blood tests over the next 24 hours anyway.
Okay.
I think it'll be at least 48 hours.
Okay, that's not too bad then.
We'll probably get some pictures of that foot just there, okay? And we'll go from there.
Thank you so much. Well, when the doctors talked to me and I was left on my own, it did cross my mind about how vulnerable you are when you are abroad. You know, there was a slight moment where I thought the possibility of being fatal.
Okay, so pop your hands down at my sides, okay? Then relax your tummy as best you can, okay?
Tom Fletcher must act fast to discover what's turning worried Barry's guts to water and infecting his foot. Barry's blood, tissue and stool samples go across the road to Wendy Bailey at the School of Tropical Medicine. Wendy is head of the diagnostic lab and is on the front line of the hunt for invasive bugs and parasites. It'll be down to her to work out just what might be invading Dr. Fletcher's patient.
The job itself is a bit like being a detective to some extent. You've got this trail, you know, you start off with the evidence, which may be the faeces or the blood sample, and you're looking for the culprit, and hopefully you're going to find it. So it's a bit of a mystery tour perhaps sometimes, but yes, it can be quite exciting.
1,500 patients a year come through the unit, and Tom Fletcher is just part of a dedicated team fighting their tropical invasions.
You can sometimes get eggs deposited in the central nervous system.
Dr. Timo Dempsey has spent 25 years investigating the lumps, bumps and rashes of infected travellers.
I find it very interesting meeting the kind of people that we meet in practicing tropical medicine. They're often adventurous, or they've had lives that are often very different to the lives of people in this country.
Timo Dempsey has a new patient, 28-year-old Emily Buckley. The seasoned traveller's just returned with her boyfriend Dave from an 18-month trip of a lifetime to the tropics. She has a mysterious lump on her arm, and it's getting worse.
Been away in Malaysia for about a year and a half, and a lump appeared in my arm, but I just didn't think much of it. I'd like to know what it is, really. I am worried, but I'm sure they know what they're doing.
In Malaysia, Emily and her boyfriend immerse themselves in local life, picking up odd jobs to pay for their trip.
You learn so much with your eyes instead of watching it on TV, and that's why I love travelling, I really do.
Towards the end of their stay, Emily had a nasty surprise.
I looked down at my arm and then I noticed a little lump in my arm, and it was only about really small, like a little round ball, it felt like, in the joint of my arm. And the locals said to me, go to hospital, you need to have that looked at. It's basically a small animal, get it taken out.
In Liverpool, Dr. O'Dempsey is hoping to discover just what's lurking inside her arm.
She ticks a lot of exposure boxes, and we're trying to kind of narrow things down.
I thought it was going to be some types of eggs, like, because I've heard of these flies that lay eggs in your arm, and I thought it was going to be something like that.
Emily's biggest fear is that she's been invaded by the flesh-eating parasite, the botfly larva. If its eggs have been deposited on her skin, the larvae would then hatch and burrow into her body. There, they would feast upon her flesh before emerging from the skin. Dr. O'Dempsey will subject Emily to a battery of tests on the hunt for the cause of the unexplained lesion. At the Royal, on call on the night shift, Tom Fletcher is summoned to the emergency department. A patient's been admitted with a dangerously high temperature.
So now he's back from Burkina Faso and has a fever of 40 and it's a bit tachycardic. And there's no other signs on exam to localise it?
From listening to his chest, he did have a bit of reduced air entry at the right base,
Okay.
so whether pneumonia shows up on his chest X-ray.
So this is a 47-year-old chap who has just been referred by the emergency department, and they've sent some bloods off. So that should be back in about 20 minutes. We'll go and see him now, get some more details, examine him, and then wait for his bloods to come back. All right. He hasn't had a chest X-ray yet, has he? No. Okay.
Ivan Sevan has just returned from Burkina Faso, West Africa, where he risks life and limb working at a gold mine. Now he's suffering from a severe fever and muscle pain. Burkina Faso is host to some of the most terrifying conditions in global medicine: viral hemorrhagic fevers. These diseases are often lethal and highly contagious. If Ivan has a viral hemorrhagic fever, the virus will attack his white blood cells, breaking down cell walls and destroying his internal organs, causing him to bleed to death from the inside.
But anyone who comes in with a fever, really, from a country where they have viral hemorrhagic fever, and Burkina Faso, it's not endemic, but it's at risk, certainly, of viral hemorrhagic fevers, then therefore you just conduct a quick risk assessment.
The initial assessment has given Ivan the all clear for a viral hemorrhagic fever, but Tom's patient is clearly extremely ill.
All I want to do really is ask some more questions really about where you've been, your symptoms, then I'll examine you fully and then we'll come up with a plan, and by the time we've done that we should have hopefully your first results back.
Okay.
Ivan's blood is sent for analysis, while Tom Fletcher works out just which other lethal infections he might have been exposed to.
When you're in Burkina Faso, where do you go in Burkina Faso?
I go straight to the mine,
Okay, all right.
and there's a camp with 900 people there.
Okay. And was anyone else sick in the camp that you'd heard of at all?
Oh, because it's a rain season,
Okay.
everybody gets sick, 4 or 5 a day. It's malaria.
So there's a huge amount of malaria
Yes.
there. Hey? Okay.
Ivan was in the unit 2 years ago, also with suspected viral hemorrhagic fever, while as a young man, he nearly died from an attack of malaria.
Okay, that's fine.
Tom Fletcher is anxious to know just what he's treating now. While Tom's fever-ridden patient doesn't have a deadly viral hemorrhagic fever, his bloods reveal something almost as lethal: the most dangerous form of malaria.
Okay, so good news. We know what it is. And well, I guess the bad news is, so it is falciparum malaria, okay? So they've just looked at a blood film now, and it's fairly characteristic for falciparum malaria.
Falciparum.
The most life-threatening strain of malaria is falciparum malaria, and that's what causes virtually all the deaths worldwide. So up to 1 million deaths worldwide is caused by falciparum.
While in Burkina Faso, Ivan must have been bitten by a female mosquito, injecting him with a malarial parasite called Plasmodium, which invaded his red blood cells via his liver and multiplied rapidly. Eventually, his cells were torn apart from within, releasing hordes of new parasites into his bloodstream. His body's immune system then mounted a defense, causing his severe fever. If not treated quickly, his parasite-infested blood cells could clog up his arteries, causing organ failure and potentially death. Now that Tom Fletcher knows his enemy, the race is on to destroy Ivan's infection. But he also needs to know how he's fallen prey to the deadly blood parasite.
So my next question is, you didn't take any malaria pills this time, is that right?
No, I never take any.
You never take any? Why is that?
I was born in it, and I was born in Africa, and I never took
Okay.
in the past.
So you grew up in Africa with malaria when you were a child
Yes.
and much younger. So undoubtedly you had some immunity. So it's a common misconception from people who are born in malaria endemic countries who come to live in the UK that they remain immune to malaria. They've lost their malarial immunity due to a lack of repeated infection. Then if they travel back, they again are at risk of severe malaria. So a little drip, bag of fluids overnight, and then the Rheomet, and then 1 full blood count when you put the drip in. That'd be great, Charles. That's not 50 Shades of something there, is it? It looks a bit rude.
In the Royal, Timo Dempsey is still working to identify what's behind the mystery lump that Emily Buckley has picked up backpacking in Malaysia.
What I'd like to do is make a firm diagnosis based on evidence. At the moment, we don't have anything more than, well, the physical evidence of the lesion on Emily's arm.
A vital part of Tim O'Dempsey's diagnostic detective work is building up a precise picture of just what Emily could have been exposed to and where.
Emily has spent quite a long period of time over the last year in Malaysia, and during that time she's been helping out in a kitchen of a hotel where she's been handling raw fish.
Dr. O'Dempsey suspects Emily may have been infected by a fish parasite. He's requested an urgent ultrasound to find out.
Can you see this bright object there, which lying there? Is it that what we're looking for?
The initial scan of Emily's arm is inconclusive, but Dr. O'Dempsey's search doesn't stop there. He's requested further scans of Emily's liver and gallbladder.
Certain species have got a habit of wandering around. Certainly the parasite that may well be causing her problem with her arm obviously is a wandering parasite, and because of Emily's history it's possible that she's been exposed to more than one.
Just take a deep breath in and hold your breath.
That's good.
So this is the gallbladder here, and within the gallbladder there's a white thing within it. It's quite long, isn't it? It's not like a typical gallstone or something like that.
We assume that this is what we're looking for, because it doesn't look like any gallstone, and she's quite young for a gallstone, so and she's quite healthy, so we don't expect gallstone in this age. So we assume that this is what we're suspecting.
Which is?
Some kind of parasite. I don't know, to be honest, but my parasite expert colleagues will know better. They can tell you better.
Dr. O'Dempsey's suspicions have proved correct. The scan of Emily's gallbladder shows clear signs of a parasite. Precisely what parasite and the cause of the lump in her arm remains to be determined. Up on the ward, Tom Fletcher has another emergency admission. 25-year-old Kaffy recently returned from visiting family in Nigeria. She's tested positive for malaria. It's not the first time she's had it.
She's actually, interestingly, having just quickly said hello to her, been in with us last year with malaria, and then turned up at the Women's Hospital today having been unwell with a fever for about a day.
Same thing happened last year. So when they took the blood, I was just like praying in my mind that, oh, let it not be like, let them not find malaria parasite.
When did you get unwell? You got unwell about just today?
Today.
Or? Okay, so you felt absolutely fine yesterday, did you?
Yeah, even this morning I was fine.
Okay.
Until I went to the GP, and as I was coming back home, I just started shivering on the road. My breathing was getting heavy, it was fast, and I was vomiting.
Okay.
My bones were paining me.
She remembered from last year that she had fever, she had this aches in her bones that she describes, and wondered herself, could this be malaria? And so she's been unwell for a day, so it's probably caught pretty early.
For Kaffy, there's a dangerous complication, one that might have had tragic consequences last time she was here.
Were you pregnant at the time as well? At that time, very early pregnancy,
yeah,
I think,
pregnancy.
as well. Okay.
But I lost it anyway.
Okay, I'm sorry about that. She had an early pregnancy and a miscarriage last time. We can't say whether that was down to the malaria she had or not, but certainly it increases your risk of severe disease in the mother, and also your risk of spontaneous abortion and of low birth weight babies. And then it increases your neonatal risk after you've been born, often when you're in an endemic country. So yes, it is more severe if you're pregnant and have malaria. And then, but you found out you're pregnant?
Again.
Again?
Yeah.
Yes. All right. And how many weeks pregnant are you now?
15 weeks.
15 weeks.
Yeah.
And when did you find out?
July.
July, okay,
Yeah.
so you've known for a bit of time.
Yeah. It's better to be safe than sorry.
Yeah, no, very true.
And I was pregnant last year as well,
Okay.
and something happened, and I don't want anything to happen.
Sure. It's a bit of deja vu, really. So your blood test that they've sent over from the women's, okay, does show that there is some malaria there, okay? So you've looked under the microscope to try and work out there's different types of malaria, okay? And it doesn't look like it's the one that you had last time, which is the one that we worry about most, okay? It looks like it's a different type of malaria, okay? Which is better because often you don't get as sick with this type of malaria.
Okay.
Tom Fletcher is keen to establish how Kaffy has become infected for the second time in 12 months.
And when you were there, did you take any anti-malarial sort of?
Yeah, I took Fansida.
Okay, for how long did you take it? Was that just a short time or?
Yeah, a short time. I think I took it for about a month. Then I stopped.
Okay, but then haven't taken anything for the last 3 months? No. Did you get bitten by mosquitoes whilst you were there?
Yeah,
much?
sure.
Okay, quite a lot?
Yeah.
And did you use a bed net in terms of sleep under nets when you were there? Not really?
No.
Okay. Most of the malaria cases come from Nigeria back into the UK, and most of them are exactly what she's done. They've gone home to visit friends and family, or for various reasons, haven't taken malaria chemoprophylaxis, then bring malaria back into the UK. So it's pretty common. It's a bit sad when you've had her a year ago and you know she's been unwell and in hospital for quite a few days, but then obviously hasn't quite taken that on board to take you know, anti-malarials while she was there. You know, she'll feel rotten enough as it is, so I think she'll appreciate it sending off from me.
Watch on mobile devices or the big screen, all for free. No subscription required. Download Beely now.
It's another busy shift for the team at the Royal Liverpool, where Dr. Tim O'Dempsey and Dr. Tom Fletcher are battling life-threatening tropical diseases. Backpacker Emily Buckley has returned to the hospital. She fears a tropical parasite has wormed its way into her arm.
I was actually wanted them to cut it open there and then, and that's what I thought they were going to do.
But after her positive ultrasound, Dr. O'Dempsey's concerned the lump on her arm and the creature in her gallbladder mean that a parasite could be burrowing its way through her body.
What was mainly bothering her about her was that it increased in size. It seemed to be moving.
At a case review, the doctor reveals what he thinks might be the parasite causing Emily's infection.
Because of the exposure history, first of all, I was wondering whether this could be a migratory fluke, for example.
A fluke is a parasitic flatworm. The larvae of the fluke live in freshwater snails, which are then consumed by fish or shellfish. If Emily ate these raw or undercooked, she too could have become infested. Undiagnosed, the adult worms could live in her bile duct for up to 30 years, potentially causing crippling stomach pain, fever, and serious liver damage. The flukes might burrow from her liver to other parts of her body, including the lungs and, most dangerously, her brain.
That's when I really started to be a bit scared, to be fair, because I was worried that if they've gone to my brain, because at the time I was getting really bad headaches.
If a fluke has burrowed its way into Emily's head, it could cause blood clots, seizures, and fatal swelling. Dr. O'Dempsey wastes no time in ordering an MRI scan to see if Emily has this life-threatening condition.
Just go round to the right, when Dr. O'Dempsey said, you're going to have to MRI scan, I thought, what's an MRI? Why do I have to have an MRI scan? And he said, because you may have some on the brain. And that is when I started to feel a bit, oh no.
And from a neurological point of view, it was important to make sure there weren't any flukes in her brain, because that would have been an important consideration when it came to treatment.
Just want to have a seat in there.
Yeah. Feeling all right at the moment, just a bit scared because I've never done an MRI before, so I'm sure I'm going to be okay.
This scan today we're doing of your head is probably going to take about 35 minutes, okay. You'll be lying on your back on the table and your head's just going to be a little frame. It gets very, very noisy during the scans, so we'll give you some headphones and you can listen to the radio as well if you want to, okay. I'll also give you a little buzzer. If you do want us to stop the scan at all, if you feel unwell, anything like that, you can press your buzzer. You all right, Emily? Okay, so the longer scans are starting now, okay.
The MRI scan uses the effect of a powerful magnetic field on human tissue to create a two-dimensional cross-section of Emily's body.
You all right, Emily? You're doing really well.
This will allow the doctors to detect hemorrhaging or suspicious foreign bodies. It's a nerve-wracking ordeal. Now Emily hopes Dr. O'Dempsey has good news.
I've just had a word with the consultant that did the scan, and she's very happy with
the results.
Images.
Oh, good. That's good.
It has to be officially reported yet, but I'm really pleased that...
Yes, they haven't gone to the brain. Yeah,
Okay.
that's good. Dr. Dempsey came to me with a smile on his face and said, "I'm pleased to tell you, you have no flukes on the brain." So I was so relieved.
The brain scan is negative, but Emily's arm is still causing her problems. Dr. O'Dempsey's determined to find exactly what parasite is behind it, so he orders additional stool samples.
So we're examining stool specimens to see if there are any eggs in the stool, because these parasites produce eggs once they mature, and that's one way of making a diagnosis.
Emily's stool samples have been sent to Wendy Bailey. Her lab work delivers a bombshell. A liver fluke might not be the only parasite that set up home in Emily's body.
We had a fresh specimen this morning, and we've done one test on it. I want to do a culture on it, which needs more specimen, because I have found a little egg in there, which is probably an incidental finding. It's probably not the cause of our immediate problems, but I would just like to do another test, because it's a parasite that we can see the egg, but I want to confirm something.
To be 5 minutes.
Just as Emily is about to leave the hospital, Tim O'Dempsey receives a phone call from the lab.
Need another specimen from
Yeah.
We're looking for lots and lots of different parasites. And she's found some eggs from a particular parasite, which it's a different one.
Oh my God! I have a few parasites inside me.
So what we want to do is just get another specimen.
Right, okay. Okay, so I need to go to the toilet. This is the 4th time I've been here.
Stool samples are very important. Patients don't always realise this. I mean, let's put it bluntly, the amount of poo they might produce in a day and the actual small volume they might give to us may be inadequate sometimes to actually find what we're looking for. Ah, that's interesting. It isn't dead. That's his death throes. That's actually been in a tube with 10% formaldehyde in it, and normally with these very thin-shelled eggs, you actually expect it to kill them. I think everybody, doesn't matter who they are, how long they've worked in a lab, if you're looking down a microscope and you see something moving, then everybody will come to want to have a look.
Emily's parasite count is climbing, but her ordeal is far from over.
She may be host to a variety of different parasites. We're not quite at the zoo stage, but we're getting there.
Hello, Doc.
Morning, how are you?
I'm not so bad, not so bad.
Dr. O'Dempsey has just received results from Wendy's lab for another recent admission. Barry Lewis came in with severe diarrhea and fever. Tests revealed a parasitic gut infection.
Right, okay.
Just,
do you know what that is? Yeah.
Well, I've read all about it now.
Have
I
you?
don't
Okay,
like the sound
tell
of
us what you've read.
It's just a bug. Obviously, it can be passed through water and food as well.
Barry's diarrhea has been caused by a tiny parasite, Giardia lamblia, which has entered his small intestine and gorged itself on his body's nutrients, causing pain, nausea and fever, as his body's immune system attacked the invaders. The parasite multiplied in his gut, then transformed into an impenetrable cyst, colonizing his entire digestive tract.
The thought of parasites in my stomach makes me feel really sick. It's like an invasion of the body snatchers. Not very nice. Not very nice. No. I dislike that a lot.
It seems Barry, like Emily, has not one, but 2 different parasitic infections.
The infection up the leg's gone down, so I feel pretty good now.
Yeah.
So
They took some samples yesterday evening, didn't they?
yeah, she did. And she said she'll obviously see what they were.
Yeah, we wondered whether this could be due to a parasite.
Yes.
It's a condition called cutaneous larva migrans, and that's caused by a parasite that normally infects dogs or cats.
Dr. O'Dempsey suspects Barry's infection may be caused by the parasitic larvae of the hookworm. Although they normally live in cats' and dogs' guts, it's possible they burrowed into Barry's foot after contact with soil contaminated with infected feces. Known as cutaneous larva migrans, in humans it can cause painful and intense itching.
The plan is for you to stay on the antiviral medicine,
Yes.
okay, to finish your course of antibiotics as well. We're going to give you some treatment for the Giardia.
Yeah.
which is just a single dose of treatment. That should settle that down. And we'll give you a single dose of treatment just in case this is underneath this. Could be cutaneous larva migraine, so we can give you a single dose of treatment for that.
Thank you.
With medication sorted, a quick record of Barry's foot is taken for the hospital's library of rare and severe conditions.
I thought I was away, you know, clean. I got away clean, like from Africa with nothing at all, just a few mosquito bites, but obviously not, no.
Tom Fletcher's pregnant patient, Kaffy has contracted a second bout of malaria after failing to take preventative measures on a recent trip to Nigeria. Even now, she's been reluctant to follow doctor's orders.
Yesterday, I felt terrible because I was itchy all over, and I was like, I'm not going to take my medicine because I didn't get much sleep, and the itching is getting worse, and I'm not taking my medicine. So the doctor now came and like, oh, you've got to take it because of the baby inside of you. You've got to get well. It was fine, so I took it. And this morning, I asked them for my medicine, and they come give it to me. So I took it, and it was fine.
Her change of heart is a relief for the team treating her and her unborn baby. Kaffy's not Tom Fletcher's only patient with a relaxed attitude to malaria. 2 days after his emergency admission with a fever of 105 and a heart rate of 140, Ivan Savin is also being discharged. Tom's hoping his boss, consultant Dr. Alistair Miller, can ram home the anti-malarial message.
Hi there. Morning. Bonjour. Mr. Savin, Ivan Savin, is it?
Yes.
Hi. And how long is it until you're going back to West Africa?
I'm going in about less than 2 weeks.
In 2 weeks' time. It's probably sensible to take something to stop you getting or reduce the... I mean, nothing's perfect. Nothing will give you a 100% guarantee of stopping getting it, but it's probably worth having something that would reduce the risk of you getting malaria. Because otherwise you're going to probably end up with another attack of malaria.
You can only educate people and then they make their own decisions. And, you know, obviously we quite like looking after them, but in the same way we'd be happier if people took all their medication and didn't, you know, get sick with malaria.
Thanks to a fast diagnosis, Ivan is discharged fit and well after 3 days.
Everything went nicely because falciparum, malaria falciparum is quite very dangerous, and I'm glad they spot it straight away.
Timo Dempsey's patient, Emily Buckley, is on her 4th visit to Liverpool.
OK, do you want to come along and I'll just explain what the latest piece of information is?
OK. As well as a liver fluke, the diagnostic lab has identified the presence of at least one other parasite.
We're kind of looking for all sorts of things, and this is one of the things that we were looking for, among others, in your stool. It's a thing called Strongyloides.
Strongyloides is a parasitic roundworm, similar to a hookworm. If Emily's infected, the worm might have burrowed into her gut. There, the female would have molted before threading itself in and out of the lining of her small bowel, causing inflammation. It's spread by contact with contaminated soil and infected fecal matter. Strongyloides can cause inflammation, tissue damage, and respiratory problems. In patients with weakened immune systems, infection circulates rapidly through the vital organs, causing the potentially deadly hyperinfection syndrome.
The parasite starts to multiply and become invasive and invades the body tissues, carrying with it gram-negative organisms, that's bacteria from the gut. So you can end up with this syndrome, which includes sepsis, septicemia, as well as a proliferation of these parasites through the tissues, and that can be fatal.
Emily is pretty certain how she was infected.
When I found out Strongyloides came from dirt and obviously from faeces, I was thinking, and in my head, I thought it might have something to do with Jambu the monkey.
For the last 8 months of her trip, Emily cared for Jambu, a pet pigtail macaque, day in, day out.
In the day, I would get up with her in the daily routine and first of all feed her. So she loved everything. Fish, she liked fish a lot, crabs. I used to wash her with warm water and put her in our room. She'd have a sleep on me in the afternoons. She's a monkey, she poos everywhere and you know, you by accident, you can touch it at some point. So in the back of my head, it was thinking that I thought, I'm surprised I haven't got any types of parasites from her, but obviously I have.
Emily now has to come to terms with multiple invasions.
So the most likely thing in your gallbladder is a fluke.
Yeah.
We've got evidence of another type of parasite in your gut,
Yeah.
which is strongyloides. And who knows what else. Quite frankly, there may be other parasites that. But
this is still a mystery of what this is, yeah?
So we won't know for sure what this is until
Wednesday.
we get it out.
Oh, right.
Put the thing in the arm. I'm hoping that we'll be able to remove it, because then we'll be able to see what it is.
And then you
Can I
treat the
see
gallbladder?
The one in the gallbladder, rather than trying to capture it live, which might be very spectacular for everybody, it may not be in your best interest for us to do that. So
Right, okay.
what we'll most likely do is treat you for that.
Timo Dempsey prescribes a cocktail of drugs for the fluke in Emily's gallbladder and the roundworm in her gut. But the drugs won't get rid of the lesion on her arm. For the past 6 weeks at the Royal, Timo Dempsey has been working to rid Emily Buckley of her multiple parasite invasion. It's taken 4 stool samples, 3 ultrasounds, 1 MRI, and an array of anti-parasitic drugs to battle the worm in her gut and hopefully destroy the fluke in her gallbladder.
There's still some kind of stuff inside the gallbladder, sort of like debris, like almost like stuff in the bottom of the gallbladder, so maybe it's breaking down.
Right, okay.
Yeah, that's what he said.
Yeah.
Disintegrating.
Disintegrating.
I'd say it doesn't look like an actual, like...
long worm.
Exactly. Yeah, so what will happen is, our doctors will review everything that you've been doing, and they will make the final sort of diagnosis and the report on it. Okay?
Yeah,
There you
thank
go.
you.
Just use that tissue right for Jella.
And I asked her, have you found anything? And she said, no, it's okay. There's little bits of the parasite. So I was so relieved to know that that parasite's gone.
The ultrasound confirms that the gallbladder fluke has been destroyed. Emily has one more parasite to contend with. It's causing a painful lump on her arm.
So, what's been happening?
Yeah, so it came about Thursday night. It started to, I could feel it started to really hurt.
So, is it sore when I press it?
Yeah. Not so much here.
Yeah.
So it's like all over here when you're doing it.
So it feels quite firm at this end.
Yeah, that hurt. That hurt, yeah, just a little bit there.
Okay.
There. And it's just really bad
Yeah,
there.
it's a bit kind of softer at this end, isn't it? I think you'll probably get more peace and quiet if we just...
Yeah, that's what I thought. I just
chop it
thought,
out.
yeah, that's what I thought. I don't mind it.
You think it's dead though, yeah, whatever's...
Well,
whatever.
that's what we thought even when I first saw you, that
Yeah.
because the irritation had sort of started
Yes.
after a few weeks of
Yeah.
the thing moving around.
Yeah.
I wondered if it was already dying at that stage. It may be mostly just inflammation around the dead parasite at this stage. I think from a symptomatic point of view, Emily would prefer to be rid of it at this stage. So if we can do that, that would also be interesting for us, because then we'll have a better opportunity to find evidence as to what exactly it is.
With Emily in pain, Timo Dempsey sends her and her mystery lump for surgery.
I'm hungry, I'm thirsty, and I'm just ready for this to be done.
We'll have a look at it and then we'll decide what we need to do, okay? But we're almost certainly just going to cut the piece of skin away. Is that okay?
Yeah.
Happy enough? The patient's just going to sleep and we're going to remove the scar. What we're going to find underneath the skin, that could be quite interesting because it's not something that we see all the time. So as I say, I hope it's not a 1 meter worm that we're going to pull out of her arm, but, but we'll find out very quickly.
The surgeon cuts around the lesion, removes the scar tissue and examines it for foreign bodies.
There's something there, I think. Yeah. We'll get it out now, put it on the table. There you go. So that's the skin with the underlying fat. It is a bit thread-like, but I can't just for definite say there's a worm in there, really. Unfortunately, nothing on that one. No, I think